Hi, I'm Dr. Noel Lucas from Blue Oasis Pet Hospital, and I'm here to take some pretty serious questions about your senior feline. I've got a few questions that you might have.
What are the signs my cat is dying?
It's a pretty serious question. What are the signs that my cat is dying? So as your cat continues to age and may develop some unfortunate life-threatening disease that we are either managing or we just can't, and we know that they're starting to suffer. Some of the most common signs that your cat is just really sort of declining in its overall health would be really just not wanting to interact with you anymore, the family. So they kind of disappear, we call it. They go into parts of the house that they're not used to being in, going underneath beds they're not used to laying under, going into closets and staying for unreasonable amounts of time and not really wanting to come out. When you do come and find them, or they do finally come out, usually they're walking really slowly, seem really fatigued. Maybe they'll eat, but it's not a lot. Maybe you're feeding them multiple times a day or offering them lots of different foods just to encourage them to want to eat because their appetites have very much declined. Maybe they're starting to change the way they're breathing and they're doing much more labored or efforted breathing. Maybe they just can't jump up onto any surface, or it's a real big effort for them to go up and down the stairs, or they go in by their litter box and they're just exhausted and they just lay by their litter, or sometimes even lay in their litter. Just really extremely odd behavior that you can pick up that either something's very seriously wrong, or we've been talking about these things and you're just seeing that decline in their health over time.
What's the difference between hospice and palliative care for senior?
Yeah, so they're not entirely different. Palliative care means, for example, maybe we have a cat that has cancer, and maybe there are specialists in the area that we can send your cat to, and we can do maybe chemotherapy for cancer, maybe there's a surgery, but you elect not to move forward with those more advanced diagnostics or specialists, and that's okay. But we still have a cat that might be doing, pretty good, and so we're gonna maybe do something to intervene with pain management, maybe some appetite stimulants, some just palliative care to just kind of continue on their life that maybe they're having a pretty okay life, and we just want to continue that as long as we can with some palliative care. Hospice care is slightly different in the sense that yes, maybe we've gone through specialists, maybe they've had a particular procedure, maybe we know what's going on, but we've just come to the end of being able to do a whole lot for them. So we will put these kids in hospice care, kind of similar to what people go through, where we know that they're dying, we don't have very much time left for them to be with you and your family, but we don't want them to suffer greatly during those last days. So maybe we'll prescribe them some narcotic pain relievers, or we'll still do maybe some palliative care with it, some appetite stimulants, but we're in much more limited period of time where we're pretty much at the end of their life.
How can I tell it's time to euthanize my cat and then transition to, would it be better if I let them go on their own naturally?
So veterinarians take an oath to end pain and suffering and support that human-animal bond. So we kind of run in that gray zone. We want to support that human-animal bond that you have with your pet. Your cat is obviously very close and near and dear to you, as they've been with you all those years. Usually in a senior cat, they could be 18, 19, 20 years old, and you've had them since a kitten. So we really understand that human-animal bond that you have with that cat. We also know that suffering is suffering, and cats do it quietly. They do it pretty gracefully, but they can be suffering very, very greatly during that time where they are in that transition time of their life. A veterinarian will help talk you through sort of what their concerns are with what they're seeing and what you're telling them. And we're going to most likely advocate to let that cat go we don't want them to suffer. I don't think you do either, but sometimes you need to hear it from us as your veterinarian and your partner in care to help make that decision with you. It is pretty hard for me as a veterinarian to know that a cat is suffering and to see that cat go home to continue to suffer and just die at home. That doesn't feel right to a lot of us because we know that cat is just suffering to suffer. And so we're oftentimes going to want to end that pain and suffering. It's a pretty serious topic of the natural progression of your cat's life into their hopefully ripe old geriatric senior years. So partnering with your veterinarian can be a really rewarding experience to help you guide the waters of your senior feline health concerns, and also to be a shoulder to cry on when it does come that time that you need to say goodbye. So if you want to talk about your cat senior health concerns, we'd love to see you here at Blue Oasis Pet Hospital. Thank you so much.